And I'm Emily Ina.
And today we are going to be presenting about the beneficial impact of health coaching on health literacy and health outcomes in low-income communities. So we chose this topic because all three of us have gone through the Med 100 and Med 200 classes at Mount Union, in which you kind of learn about health coaching. And then Emma and I both serve as current health coaches at the moment and will until we go off to medical school. So we've just definitely seen a personal impact in this. So we wanted to look further into this for our project. So the answer to why we need health coaching is definitely not a statement that presents a clear problem and solution. The need for health coaching exists for a multitude of reasons, and while I could gladly offer you our paper to read if you'd like the in-depth explanation, I'm just going to highlight a handful of the more prominent reasons. As a whole, patients who are in health coaching programs, at least the one that I'm familiar with at the Alliance Community Hospital, are in these programs because they're labeled as non-compliant. This means that as a health coach, that we're there to help our patients and hopefully in turn increase their compliance to their healthcare team's orders. Now, certain things that qualify a patient as non-compliant include not taking their medication properly, not following a diet that they were told to follow, and or not following any other directives that their doctors give them. Health coaches kind of exist as like the middlemen between patients and their healthcare teams, as unfortunately the reality of the situation is that doctors and nurses just don't have the time to be regularly checking in on and making home visits to all of their patients. All in all, the quote that you see there on the screen, Norman and Bobber explained in their 2020 article that health coaching can provide task clarification, help set goals, and help evoke or reinforce certain behavioral changes.
So, as Kaylin kind of mentioned before, because Kaylin, Emily, and I are all interested in the healthcare field, we knew that for our project, we would want to address a healthcare issue in our community. So, the unique experience that Kaylin and I have had being involved in the local health coaching program raised our awareness of key health literacy and compliance deficits in the local patient population. We decided that we wanted to dig deeper into the causes of this issue. What we discovered was a link between the health and economic status of community populations. So according to an article by Odutayo et al. From 2014, communities with lower incomes have been found to have higher rates of heart disease, diabetes, and obesity. And these are some chronic illnesses that require management of over a large period of time and must be managed on a daily basis, in addition to periodic monitoring by healthcare professionals. In addition to this, an article by Herman and Jackson in 2010 linked low-income communities to decreased health literacy and lower patient compliance. Health literacy and compliance with professional healthcare advice are both critical to the effectiveness of the care that patients are receiving. So the combination of these two issues, the increased chronic illnesses that rely on that heavy self-management with that decreased compliance and health literacy in the low-income communities, such as Alliance, leads to poor health care outcomes and misuse of the available healthcare services, which was suggested again by Singh and Stupans in their 2020 article.
So how can we help? Well, health coaching has been taking place in many different settings, such as hospitals and gyms for years now. But not only have they been in these locations, but locally they have been in Altman Alliance Community Hospital, as Kaylin and Emma has mentioned. And they implement this by a program through the University of Mount Union, where students are able to take classes educating themselves in health coaching before being assigned a patient from the hospital. And just observing the success of the hospital and the university's collaboration with health coaching, we proposed a program very similar to the health coaching program in the Alliance Community Hospital as well as Mount Union, but instead we wanted to focus more on younger individuals such as high school students and middle school students. So by beginning health coaching training early, this could help the students in their classroom settings to develop maybe a passion for healthcare, as well as gain more health literacy skills and motivate students to volunteer more in the future. We also think that by having high school level students do this, they might be able to form a greater bond with younger students, such as in middle school, where we've seen a great impact in childhood obesity numbers, as well as making a long impact on healthy lifestyle choices. So in order to do this, our plan of action included talking to former health coaches, contacting the local representative from Altman Alliance Community Hospital, Natalie Houston, that has been kind of like the main lead in the Altman Alliance Community Hospital program with Mount Union, as well as contacting local schools such as Alliance Middle School in Marlington, as well as academic advisors such as Tammy Cole Kennedy from the University of Mount Union. By doing this, it'll allow us to gauge how individuals from different backgrounds feel about our project and give us a wider perspective on how to successfully implement this in the future. Because this project only took course over a semester, we knew it wouldn't be able to fully take its full course or be implemented, but we did want to still have an open communication and just kind of get the idea out there. So Kaylin now is going to talk about what she found from previous health coaches.
So in looking to get additional feedback from other individuals who have gone through the health coaching program, we reached out to past health coaches, with a few questions. While certain individuals were health coaches for less than a year, others were part of the program for 4 years, but regardless, they all provided passionate, informed responses to all of our questions, which was really nice. It was clear from the responses that they had all been positively impacted by the program. They each cited multiple personal examples of times that their health coaching had impacted them and times that it had impacted their patient as well. When asked what the most beneficial thing was that they got out of health coaching, one individual responded that learning how to interact with people facing challenges that they themselves had never personally experienced was really huge for them. Another responded that they have learned that a meaningful and productive patient health coach relationship goes far beyond medicine. Because it's important for us to recognize the downfalls of a current system already in place, if one hopes to create even more of these programs, we asked the former health coaches for information that they wish that they had learned before becoming a health coach. Responses to this question included more information regarding the insurance system, pharmacy etiquette, telemedicine skills, especially during this pandemic, and finally, how to comfort adults when they cry and how to address questions or comments regarding death and dying. Because we have to acknowledge the fact that some of these patients that are health coach subjects are in reality really, really sick. Finally, in looking for some feedback regarding our proposed implementation of health coaching programs at a younger age, such as in high school, we asked the health coaches if they could see a benefit of implementing such a program at this age. In accordance with what Natalie Houston commented when asked, which Emma will talk about here in a second, all the coaches surveyed agreed that the spread of health literacy to the younger generation is a positive thing, but that at that age, the students aren't necessarily responsible enough to handle the responsibility that comes with being a health coach.
So as Kaylin mentioned before, we were super grateful to have the opportunity to talk with Natalie Houston. She's a nurse at the Alliance Community Hospital and is also the program coordinator for our current health coaching program, which is partnered between the hospital and the University of Mount Union. So we were excited to gain some insight from someone who has had such a great involvement in the health coaching program and who might play a role in implementing new ideas for the program in the future. Natalie was quick to share the impact that the health coaching program has had on her perspective as a medical professional. And she believes that health coaching has helped her to understand the barriers that many people face when seeking medical care, such as the high cost of care, difficulty understanding the physician's instructions, and even transportation to attend appointments or pick up prescriptions. Natalie says that these types of underlying barriers are something she recognizes more easily now, and that they've helped her to provide care with even more empathy and understanding than before. Natalie agreed that implementing health coaching training and health literacy education in high schools would be a great way to improve health literacy and compliance in future generations and to increase the interest in healthcare professions and volunteer work in these students. But Natalie did not feel that high school students possessed the maturity level to take action as health coaches just yet. With Natalie's input, we gained insight towards the age and maturity issue of having high schoolers act as volunteer coaches, but we also learned how implementing the educational part of our idea could be extremely beneficial in the community and for healthcare in future generations.
So after reaching out to a principal from the Alliance Middle School, Marlington Middle School, and Phoenix Rising, which is a behavioral health center here at Alliance, I only received a reply from the guidance counselor at Marlington. And although she was interested in the program, she wasn't too sure how it would be implemented right now, or if high school students, as Natalie suggested, had the maturity level to work with the students in middle school. However, because I didn't really get too many replies with the current situation of COVID-19, it's completely understandable that implementing this program would probably be nearly impossible right now. But in the future, I still think it'd be beneficial to meet maybe in person and discuss more the logistics of a health coaching program in a high school and what it would look like, as well as inviting Natalie, maybe another healthcare representative, to gain some more input. Some of the concerns that the guidance counselor mentioned was that because the students are minors, parental consent would be required in order for them to participate, as well as making sure that the health coaches would have a way of getting to their clients, a way of transportation. Another concern that I received was that the health coaching program might be misinterpreted as just another volunteering opportunity or maybe even a mentorship. And while it is almost a mentorship, and it plays a large role in health coaching, it's important for the health coaches to understand that they are the real connection between the doctors and the client. Therefore, they have to be able to recognize the healthcare red flags and be able to report back to medical teams in a professional manner, as well as a timely manner, and not just like blow this off as volunteering and doing the service or the service work whenever it's convenient for them. They would still have to make sure they're checking in with their client every week and, like I said, maintaining an open communication. I also reached out to Tammy Cole-Kennedy because she's the director of academic support here at the University of Mount Union, and she actually helped me get into contact with the individuals from the local schools. She as well provided me some advice on how to match health coaches with potential clients by using things such as a service or an interest survey. She also posed the idea that individuals that might be interested in becoming health coaches should be screened academically to make sure that they show intellectual curiosity as well as a hard work ethic. So once again, although we didn't have full intentions of implementing this program right now, it was a great way and a great start to engage with the community, allowing us to truly reflect on all that we've learned through our time here at the University of Mount Union, and specifically how maybe a transhumanistic world could impact this in the future.
So now just for a couple little final thoughts from each of us. I thoroughly enjoyed this project and the research and communication that went into making it happen. I think that overall our project was effective in the sense that we were able to complete the planning steps of what would ultimately become a much larger undertaking. While our actions for this project may not actually end up benefiting the community, as we won't be moving forward with the development of the project, I think that the work that we did put into this assignment would serve as a very strong foundation for such an endeavor. Now, because the topic of this class is transhumanism, we wanted to take a look at what a transhumanistic future would mean for health coaching. And I think that health coaching would undoubtedly be different in a transhumanistic future. First and foremost, health coaches could very well become a thing of the past, in my opinion. While there is a very important human element to health coaching and the meaningful conversations that are had during each visit, the other aspects of health coaching that require a human being pretty much stop there. Realistically, a robot could perform all of the tasks that a health coach is responsible for, such as any medication that they're taking and ensuring that a patient is following all the other tasks that they are responsible for, other doctors' instruction, things along those lines. They would be able to record any persisting health troubles and relay this information back to the team of healthcare professionals of the patient. As we have discussed in our Honors 410 class before, a point that I frequently made up is that in my mind, transhumanistic elements in medicine are often able to be viewed as just yet another tool in the doctor, the physician's hands. And I think that this could very well become applicable to health coaching in a transhumanistic future, because health coaching could become as simple as a robot that is just sent out to the patient's home to ensure that they're, following directions to their healthcare team and then relay that information back to the team. But having personally experienced the positive impact that health coaching can have on both the patient and the coach, it's sad to think that a transhumanistic future could come in which the human health coach is eliminated.
So I really believe that though we were unable to implement that program given the circumstances of COVID-19, our communication-based actions were successful in helping key community members reflect on our issue of choice. I think that the conversations we had with former health coaches, the coordinator of the health coaching program, and the local high school administration has sparked an interest in implementing a health coaching program and health literacy education at the high school level. I truly believe that education will make a difference in the prevention of chronic diseases such as heart disease, diabetes, and obesity, in addition to improving the self-management of these diseases at home. Health coaching is already making an impact not only by aiding patients with health literacy and encouraging compliance, but also by building trusting relationships between patients and coaches and the healthcare system itself. Like Emily mentioned, health coaches act as mediators between patients and healthcare professionals, but I really believe that they serve a much greater role. For this reason, I don't believe that any future transhuman technology could entirely replace health coaches or health literacy and compliance training. Sure, some of these new devices being invented can track biomarkers in the body and even make diagnoses, but they can't convince a patient to comply with healthcare advice. I do believe that technologies can become a link between patients and physicians as informers, but I don't think that technology can further develop patients' trusting relationships with healthcare providers or improve compliance significantly. For these reasons, I believe there will always be a role for health coaches in our healthcare system.
Just kind of going off of that and reflecting on our project, I do think our plan of action was executed very well, and our results were very beneficial for hopefully in the future, allowing someone else to kind of take our project and keep our work going. By working with local schools, it made it easier for us to contact them, as well as reaching out to faculty members at the University of Mount Union. And I believe that by keeping our project local, it helps to create a stronger motivation to complete the project, as Alliance has become a home away from home for me personally, I know. And in a futuristic, or in a transhumanistic future, I do think that health coaching would be very different. And kind of agreeing with Kaylin, I do think it might ultimately be eliminating. The main purpose of health coaching is definitely to build a good relationship with patients and their doctors through an individual that they feel that they could trust. So agreeing with Emma, I do think that health coaching or health coaches provide that more humanistic feel and making sure that their clients are complying to the advice of their doctors and adding that emotional element to it. I do think maybe in a transhumanistic future, though, having things such as Neuralink or a microchip that could be embedded that maybe kept track of their blood glucose levels, the pH changes, temperatures, as we already talked about, the dermal tattoos that are being made right now. Doctors might be able to just go in to a computer system and check all of their levels and then reach out to their patients if they feel there's an issue. So I think technology might eliminate the need for the middleman, in this case, health coaches, between the doctors and their patients. The world of medicine is always changing, though, so the new technology being discovered, I think it might, like I said, be eliminating the health coaching aspect. In the future, though, I think that we did successfully complete our goal of raising awareness in the community and getting their interest out there of expanding the health coaching program to increase health literacy education into the high school environment. So we now have our sources, and we are willing to take any questions if you have any.